All right. Good afternoon, everyone, and thank you for joining the Health Department's weekly Friday briefing with Dr. Farley. Today, we're joined by Dr. John Gleason, who's Executive Vice President, James D. and Mary Jo Dinella, Chief Quality Officer at Thomas Jefferson University Hospital. Both he and Dr. Farley will be talking about COVID-19 vaccine distribution and ways that the city is making it available. Following their skipping that part. Unfortunately, we do not have access to Spanish language translation today. If there are questions in Spanish, Zelly is here to help answer those questions. We can follow up with prepared remarks in Spanish afterwards upon request. After Dr. Gleason's comments, we will open the floor up to questions from the press. Today, we are shooting to end for 1:30. Dr. Farley, I will kick it over to you to start us off.
Thanks very much, Jim. Before we get into vaccination, just want to remind people that case counts from the coronavirus infection and hospitalizations are continuing to rise. So as much as we want to be vaccinating, we also need to mask up and keep our distance. We haven't vaccinated enough people yet to prevent this epidemic wave. Now on to vaccination. First, the supply of doses that are going to the city is continuing to increase. The federal government surprised us earlier this week by increasing the doses of Pfizer that are being delivered to us. They increased the number of first doses from 22,230 the week before to 26,910 that we're ordering this week, and that will be delivered next week. Those are the first doses of Pfizer vaccine. Moderna vaccine is unchanged. We're getting 15,600 first doses of that vaccine. We were also surprised, and pleasantly so, to be told earlier this week that we're getting 9,200 doses of the Johnson & Johnson vaccine this week. No promises from the federal government about what we were getting in future weeks for any of those vaccines, but certainly we have been getting increases, and those are welcome, and we hope they'll continue. Where are we on administration of vaccine? As of last Thursday, we reported, that is yesterday, that we vaccinated 470,000 people with their first doses and 192,000 people with their second doses. Now, I should note, if you're looking at our website dashboard, that there was a problem on the dashboard that we noted yesterday that is underreporting the people who are partially vaccinated. We're working on fixing that problem. If you look at some of the numbers lower down in the table rather than at the top of the table, those are accurate. For the week that ended March 14th, of all the providers in the city, 109,000 doses were administered over that week. That's up from 54,000 2 weeks before, so that's more than doubled. Then the week ending March 21st, that's last week, so far, 102,000 doses have been administered. We've learned that there's often some reports that come in late, and so that 102,000 number is likely to rise. So both of those reflect a big increase in vaccinations. In large part, that's due to the vaccinations at the convention center. We've also had increases by other providers. Now on eligibility, as you know, we're still in phase 1B. And phase 1B includes people who have high-risk medical conditions. And as you know, earlier we reported that we recently added to the list of high-risk medical conditions, people with intellectual disabilities. That is because those high-risk medical conditions are based upon scientific evidence that those conditions do increase your risk for serious COVID infection. And that addition of that was based on a study that was done by Dr. John Gleason. And so I'm pleased that he's here today. First of all, I'm pleased that he did this study. And second, I'm pleased to hear today for him to talk more about that population and what we're doing to serve that population. Now, how is vaccine being made available today in general across the city? We're now up to more than 200 providers who are receiving vaccine and are administering that vaccine. This week, there are new community clinics being run by the city, in this case by the Philadelphia Fire Department. On Wednesday, we were at Cannstatter, Volkswagen in the Northeast. They vaccinated some 525 people. Today, we're at the Salvation Army at 501 Market Street in West Philadelphia. And then Sunday, Monday, they're going to be at 7,800 Ogons in the Northwest. Now, the Center City Vaccination Center at the Convention Center continues. They're doing their second doses today of people who received their first doses 3 weeks ago, and they're vaccinating about 6,000 people per day. Now, some good news I can report today is that we will be adding providers to do more vaccinations. These are providers who applied for funding from the city under the city's request for proposals. These proposals were reviewed by a committee that included representatives from different divisions of the health department, as well as one representative from the Department of Commerce and one representative from the city council. The idea is that these are providers who are going to vaccinate people who are underrepresented in our vaccination statistics or are hard to reach. There are 7 organizations that were approved and will be funded. We are still working out the contracts and the budgets for these organizations. So all I can tell you today is the organizations that were approved. And they are the Albert Einstein Medical Center, the Black Doctors COVID-19 Consortium, MyDoc Urgent Care, Sunray Drugs. Now there's 2 related to Temple. There's Temple University, Maine, and there's also the Temple University College of Public Health, and then Thomas Jefferson Hospital. We look forward to working with those providers to reach the additional folks that they're going to reach. Now, some of those providers are already underway vaccinating people, and others will be getting soon. And just to point out that the request for proposals is still open. It's an open-ended call. And so if there are other providers who want to come forward, they can put in an application and they will likewise be reviewed. Also, just to update you, we have a plan about our vaccine distribution. And because the facts change so quickly, we have had to revise that plan frequently. We do have a revision that we will be releasing today with more information about the vaccine providers that are available and how we plan to work with that, and updated estimates about how many doses we can be distributing in the next few weeks. With this plan and better information than we had before, we estimate that by the end of April, we may be delivering as much as 160,000 doses per week across all the providers in the city of Philadelphia. Now, as vaccine becomes more available, there's going to be an increased importance for us to urge people to get vaccinated who may be somewhat hesitant to get vaccinated. So this next week, we'll be starting a media campaign to do that. And this media campaign is different from what you might think. It's rather than telling people how serious COVID is, because we think most people know that, with a negative message, this ad campaign has a positive message. It emphasizes how vaccination will help us get our lives back to normal. It shows people doing in Philadelphia what they love to do and that they have not been able to do for so long, like having a meal with their friends or hugging their grandmother or going to church. And the slogan for the campaign is Vax Up Philly, similar to our Mask Up Philly. Now, this campaign is going to start small, but it'll grow over time as vaccine becomes more available. At first, it's mainly going to be on social media and in community and ethnic media. And later, we'll add radio and television and public transit and posters and flyers that we'll be distributing through grassroots dissemination. In addition, the Mural Arts program will be participating, and they'll be doing murals throughout the city showing the positive benefits of vaccination. This campaign is expected to last about 6 months. It's going to cost about $1.5 million. And it will change over time as we learn more about how people respond to it and as the situation on the grounds change. In the future, we also, as part of this campaign, we'll be showcasing trusted messengers in Philadelphia, delivering their own messages about how important it is to get vaccinated. So that's the update for today. Just to remind you that if you want to get vaccinated and you don't know how to get in line, go to our website, www.phila.gov/vaccineinterest, and sign up in our database. And if you don't have internet access, call 311 and someone will put you on that database for you. Thanks very much.
Thank you very much, Dr. Farley. Dr. Gleason, I would like to have you come on and chat with us and tell us what's happening.
Sure. Thank you, Dr. Farley, for the invitation on this beautiful Friday afternoon here in Philadelphia. I am grateful to have the opportunity to summarize the work that we've done that Dr. Farley mentioned. We suspected that COVID-19 was having a significant impact on individuals with intellectual disability because of our own clinical experience at Jefferson in caring for this community. Also, we know that the risk mitigation strategies that we use to prevent the spread of COVID-19 are primarily behaviorally based. Wash your hands, wear a mask, keep your distance. And for people that may not have typical control of their behaviors, these prevention methods are less effective. So we conducted a large study, including more than 64 million patients that had established care at more than 500 health systems across the United States. And to very briefly summarize our findings, we found that having an intellectual disability is the strongest independent risk factor for having presented with COVID-19 during the pandemic, and was the second strongest independent risk factor for dying from COVID-19, second only to age. And since that study came out, and even prior to that study, there have been other smaller studies that have substantiated our findings. And our large study came out in the New England Journal of Medicine Catalyst exactly 3 weeks ago today. So the immediate implications of the findings are really about vaccine prioritization, and the response has been remarkable. The study was released, as I said, 3 weeks ago, and we've already seen the extension of vaccine prioritization to people with intellectual disabilities in at least 9 states, and also here in Philadelphia under Dr. Farley's leadership. We've also seen movement internationally on this. For example, in the last week, Japan has extended vaccine prioritization to individuals with intellectual disabilities. So that's the short-term work that needs to occur and is occurring here in Philadelphia. Longer term, the opportunity is really for us to better understand healthcare access in this wonderful and vulnerable patient population. And I think measurement is in order, and having better ways to measure healthcare access and outcomes in this population is something that we're all interested in. I do want to thank Dr. Farley and his team, and also the Vaccine Advisory Committee for making vaccine available to this group. And I know that plans are underway to reach out to this community in special ways. So again, thank you. I appreciate the opportunity to come on and to speak about this.
Thank you very much, Dr. Gleason. Because we are skipping Spanish translations today, we're now going to move to our Q&A section. As usual, reporters are asked to limit their questions to 2 or fewer. Please try to keep the questions focused on the topic at hand, which this week does include the work that Jefferson Health is doing and work towards intellectual disabilities access to the vaccine. If there are any reporters who do not get the opportunity to ask their questions, please follow up with us via email and we will get you an answer. First up, we will go to Danny Freeman at Channel 10. Danny, you should be able to unmute yourself.
Thank you all. This is a question for Dr. Farley, and I apologize if it is slightly off the topic of this particular subject today, but I just got to ask, this weekend, of course, is Passover. The coming weekend is Easter weekend. A lot of families want to be gathering and want to be sitting around the table together, some who are vaccinated. Dr. Farley, what would your recommendation or your message be to those people who want to gather for Passover or Easter while acknowledging that cases are rising?
Are you with us?
Yeah, sorry about that. It took me a minute to unmute here. I very much appreciate the fact that people want to get together with their relatives, but we know that getting in together indoors over a meal where you're not wearing masks is probably the most dangerous thing that you can do for spreading COVID. At this point, not enough people are vaccinated for those gatherings to be safe. I can almost guarantee that in any family gathering, there's going to be some people who are unvaccinated. So I would recommend the same thing we recommended over Christmas and New Year's. Don't get together with your relatives, people you don't live with, over the holidays over a meal. You can celebrate over Zoom. You can get together people that you live with. If you want to be around other people at all, you need to always be wearing a mask. And some people think that just testing before is going to help, but testing really is not, it can't be done quick enough or frequently enough in order to prevent the spread there. So it's a really important time for people to be careful.
Thank you, Danny. Anything else?
No, thank you very much, Dr. Farley. Appreciate it.
Thank you. Next up, we're going to move to Max Maron from Billy Penn. Max, you should be able to unmute now.
Hi, Dr. Farley. Thank you, everyone. A question for you about the new projections you have for vaccination distribution by the end of April. The numbers in the last 2 weeks appear to be on the decline, and I was wondering if you could speak to what the factors are that have caused the numbers to drop so far.
Yeah, the numbers that I'm looking at I'm not seeing a decline. There is what you're seeing on the website shows incomplete data, so the most recent bars are not everything they'll be when all the data comes in.
Even the week prior to this week, it had dropped down by about 9,000, 10,000 doses.
Yeah, week. I saw that, and I asked my staff about that because there's a different report that I get, and I said, is the data on their website accurate? And they said they were checking into that. The report that I'm looking at, I think is accurate. These are the numbers I've been reporting. So we know the week before last, and we start and end our week on we go Monday through Sunday. Week before last, we were 109,000 doses. Before we were reporting that about 102,000 doses, but there were about 7,000 that came in late. Last week, we know so far of about 102,000 doses. We think we'll probably be up 109, 110,000. So at worst, will be about the same between last week and the week before, and it was much lower before that. So I do think overall we're still on an increasing trend. There will be some fluctuations as, for example, as CHOP finishes up their vaccination of teachers, but the overall increasing trend is still something we're confident in.
So then I want to ask a question looking forward. I mean, it's those numbers, even as you're reading them, seem to, which are different than the data on the website, but I can follow up about that later. They do seem to be plateauing, and the projection to have 160,000 doses per week within a month. I'm just curious how you got to that number. It seems that it's heavily reliant on the possible addition of 2 FEMA sites, and I just wanted you to speak to that.
Yeah. So we looked at all the different providers that are providing vaccine. Hospitals, clinics, pharmacies, how many doses they're providing on average, and how the number is growing, and then how the number of providers is growing. And that's what the projections are based upon. They do build in an assumption that there will be an additional federally supported site, what we call a type 2 site. I don't have any to announce today, but we're very hopeful that that'll happen, and those are built into those assumptions.
Okay. So you're not worried about the plateau, just to be clear?
I'm definitely worried about anything that's not increasing, but I'm still feeling good about the overall long-term increase here.
All right, thank you.
Thank you very much, Max. Next, we're going to go to Sean Walsh of the Inquirer. Max, you should be able, or Sean, you should be able to mute.
Thanks very much. Dr. Farley, can you talk about what the city is doing to track variants within the city?
Now, the testing of variants is something which needs to be done by a very specialized laboratory. There are a couple of laboratories, I believe, that are in the city that are doing this. And there's also a special program at the Centers for Disease Control to test a sample from many locations around the country, including Philadelphia. And so we are in contact with those laboratories, both the local ones and the CDC, and are simply getting the numbers that they are aggregating. I have seen national data that shows an increase over time. And I have not seen data for the city of Philadelphia with both numerators and denominators, but I've heard numbers. And there's no question that our numbers are increasing.
Just as a follow-up to that, is that a major concern for you?
I'm concerned about it. Now, I will say that the variants that we're seeing appear to be the ones that arose mainly in the United Kingdom. And those variants are not more serious. They're not more likely to kill you if you get them. They are more transmissible. So that's not a good thing. They are prevented by vaccine. And so these are, if you want to say that, not as bad as some of the other variants around the world. And if you look at the United Kingdom where they arose, case rates are falling quite well now. So I don't think that the United Kingdom variants change our strategy. Strategy is still wear a mask, keep your distance, get everybody vaccinated, and that'll work even if those variants are predominant.
Thanks. And lastly, could you expand on the 7 new sites that you announced today from the RFP? How much vaccine are they getting? What exactly do they have to do to reach those communities, or do they kind of fly on their own with that, or is the city requiring them to prioritize folks? So just expand on how that works.
So each organization had to present a plan for who they were going to vaccinate, how many people they're going to vaccinate, and they were approved in part based upon whether they're vaccinating groups that were underrepresented or were hard to reach. And that included in that was how many they estimate they were going to vaccinate. And so, I mean, in general, these are groups, organizations that may be vaccinating between 1,000 and 5,000 people per week. And the numbers also depend on how hard to reach the group is. And we will be, the health department will be providing them enough vaccine to do that.
Thank you, Sean. Anything else?
No, thanks. Appreciate it.
Thank you. Next up, we'll go to Rudy Chinchilla from Channel 10 Telemundo. Rudy, go ahead.
Hey, Dr. Farley. So I'm just trying to, because you said there's some issue with the data site, trying to figure out sort of what numbers to go with. I think you mentioned 400.
I'm sorry, Rudy, I'm having trouble hearing you. Could you speak up or get closer to the mic?
Can you hear me?
That's better. Yes, thank you.
Great. All right. Yeah, I just wanted to, because you mentioned there's a problem with the data site, figure out sort of what numbers to go with. I think you mentioned 470,000 people have received at least 1 dose.
Right.
And the numbers I'm looking at the site right now would actually put it above that, would put it at about 483,000. So I'm just sort of wondering if we should be going with numbers that are posted to the data site or the ones you just gave us.
No, it probably the 4083 is correct. The 478 is what I had last night, but it updates all the time. The number that was posted last night was 291,000. It was way off. And so they may have corrected the problem. And so 4083 sounds about right.
Okay, yeah, the 291. Yeah, I think what's happening, it seems then, is that it's showing the partially vaccinated in one column and the fully vaccinated in another column. So it's not doing the addition. But in that case, it seems like the numbers there are still accurate. I guess we just have to do our own math in terms of figuring out how many people have received at least one dose, right?
Yeah, it sounds right.
Okay, excellent. Thank you. Appreciate that clarification.
Thank you much, Rudy. Anything else?
That was it. Thank you.
Wonderful. Next, we'll go up to Kennedy Rose from Philadelphia Business Journal. Kennedy, you should be able to unmute.
Hi, Dr. Farley. Thanks for taking the time. I have a few questions about the media campaign you mentioned a little bit earlier.
Yes.
I was wondering, why is the city putting together a media campaign to combat vaccine hesitancy? I was wondering what sort of hesitancy you are seeing.
We have definitely seen people who are reluctant to get vaccinated. And I have not talked to them myself personally, but there's survey data showing that. And then every time we offer vaccine to a group of people, we hear a certain percentage that just say they're not interested in getting vaccinated, at least not now. And the general responses we hear about why is that they're just, the vaccine seems too new, that they're not necessarily ready to trust it yet. I'm still hopeful that when people see other people like them getting vaccinated and doing well, and maybe even see that in contrast to other people who are not vaccinated or not doing well, that they'll change their mind. And so the media campaign is about building this kind of a movement for everybody to get vaccinated.
All right. And do you know if the city is working on this own campaign in-house, or is the city working with any local businesses to put together the campaign? How is that all shaken out?
We are working with a group of businesses to do this. The lead agency is called Banduho, who is a minority business, and it is working with two other local businesses that I am. I'm sorry, we can follow up. I'm forgetting the names of the other two for as far as community penetration.
I'll shoot you an email. Thanks so much.
Wonderful. Thank you very much, Kennedy. Next up, we're going to go to Jeff Cole from Fox 29. Jeff, you should be able to unmute.
Yeah, Dr. Farley, you've said a number of times, I think you said it even this morning at the Salvation Army event, that, you know, there are 1.2 million Philadelphians that we want to vaccinate. But it seems unlikely that you'll get to 1.2 million, although I see here, obviously, you're trying to get to everybody. What's a good number? I mean, what number of residents, and I know you want to get to 1.2, but what number of residents would you be pleased with?
Well, you know, right now, if we got to 70%, I feel like we're making great inroads. Whether 70% will be enough to make this virus start to go away, that's unclear. And maybe we need to get to 80%. But right now, if we get to 70%, I'd say that's a good number. I should point out right now, children are not even eligible to be vaccinated, right? The vaccines are not approved in children. But there's studies that are being done in children. So I'm hopeful that by the end of the year that we will be able to vaccinate children, and that'll boost the percentage of the overall population that are vaccinated.
But 70%, would it, in essence, end it? Would it allow you to pretty much fully open the city?
I don't think any amount of vaccination that we can do is going to end this epidemic. The virus is going to be with us for at least another year or two. We need to learn how to live with it. And so we're still going to be probably wearing masks for quite some time, and still going to be having some limitations on how we get together for quite some time. 70% may reduce it to low levels, and we hope it will. And that we'll use these other strategies to get us the rest of the way to protect us as much as we can.
I appreciate it. Thank you.
Thank you so much, Jeff. Finally, we're going to shoot over to David Milandra from Philly Sports. David, you should be able to unmute now.
My question is for Dr. Farley. Since the sports fans have been allowed back into the stadiums, have any contact tracing has led to the rise in cases lately, would you say?
We've not been aware, at least I'm not aware of any clusters that were traced to the sports stadiums.
But just another one for you is, do you believe it's too soon to say to have fans inside for stadiums for the indoor events? Or do you think you should make a ruling to say, I don't know, say by April 30th, allow them back in, or do you think it's too soon for that?
There are fans in the stands in the indoor events now, so we do allow fans in the Wells Fargo centers. Is that your question?
I'm basically saying is that I've had a lot of people saying, did the city of Philadelphia jump too soon to say to let the fans back in?
Oh, was it too soon?
Yeah.
You might question whether our whole range of restrictions was something we shouldn't do. Every step along the way with this epidemic, we're trying to balance the protecting people from the virus with the fact that life doesn't go on. And if we try to shut off everything, that there are some very bad consequences of that, including health consequences. Have you noticed we've had a surge in gun violence? We've had an increase in overdose deaths. We have a lot more problems with mental health. So we're trying to find that balance here. And as case rates were falling and vaccination rates were starting, I think it was appropriate for us to carefully roll back some of those restrictions. If we think things are rising too much, there's always the opportunity for us to reimpose restrictions. We'd rather not, though. We hope that the vaccination will take us the rest of the way.
And my last one for you will be, what is your message to those people that will be attending the Phillies home opener next week?
Wear a mask and stick with your household members only so that you don't have the opportunity to spread or catch the virus.
All right, thank you.
Thank you very much, David. I'm not seeing any more hands raised, and we have reached 1:30. So I wanted to thank everyone for coming to today's press conference. That concludes our agenda for today. We will see you all on Tuesday. Have a good weekend.